Hi everybody. My name is Karthika. I am one of the dietitians at Tucker Medical. Just a little bit of background about myself. I used to predominantly work with the oncology population, and now I'm working in metabolic health as well. We're all really happy to be presenting this webinar for you at a time where things are quite different. I'll let my colleagues Ashrafi and Bonnie introduce themselves as well.
Hello, everyone, and thank you for joining us. I think many people from out of Singapore, some from Singapore, some familiar names. So welcome to this webinar. We are all very excited. The nutrition team from Tucker Medical are really excited to sort of share some facts, some tips, as well as some links. And my name is Ashrafi Bhagat, and I'm a nutrition coach and with Tucker Health. I do work with patients and sort of guide and advise on how to prevent as well as reverse chronic diseases like heart disease, type 2 diabetes. I'm really passionate about, grow your own food, and as a result of which I have this, I'm a co-owner of a urban farm where we grow greens and vegetables and microgreens, very topical, I must say. So welcome to the webinar, and thank you for joining us.
Thank you.
Hi, my name is Bonnie, and I'm one of the dietitians. I've been working as a dietitian for the past 7 years, and I used to work at SGH, and then it was Tan Tock Seng Hospital, all in Singapore. I originally was from Australia. But yeah, I'm really happy today to share with you about some of the nutrition and lifestyle advice on how to keep healthy during these tough times. My personal passion, just like as a hobby, I enjoy like fermenting stuff like kombucha and kefir and yogurt. So I'm really into the gut microbiome, and we'll be sharing a little bit more about that as well.
Definitely. Thank you, Bonnie. So I'm just going to go over some ground rules and agenda for today. We're going to start off with answering some of the questions that we already promoted this event with. So we'll start off with like masks and how to incorporate movement, meal planning tips, and things like that. And then we're going to answer some of the questions that you guys submitted during the registration process. And after that, if you guys have any questions, while we're talking today, you can always submit those questions in the live chat. Please do not, unmute yourself. I don't think you can, but submit all questions from today to the live chat. So we'll do questions from the previous agenda, questions that you guys submitted, followed by live questions. The entire webinar is going to be recorded, and we'll send it to you later on if you need it. So, do not worry about any of that. And we're also going to send you some extra resources with answers to some of the chat questions that we may not be able to cover towards the end of it as well. So we'll get to all of them, if not today, via email at some point. All right, so we can get started with some of the questions then. Next slide, please. All right.
Right. So, okay, awesome. So, yes, masks and face covers, as well as hand sanitizers and washing hands, all recommended and by the government, as well as health professionals, doctors, definitely will reduce your exposure and susceptibility to COVID-19. So, yes, please do carry on. We have some two interesting links which we'll share with you later, and it's both about masks and what kind of masks you should wear and when, and as well as in some places we can't get masks and not easily available, so you might have to make the masks, and so we're going to share that link as well. And yes, please keep wearing your masks and wash your hands and use sanitizers and be safe.
Yeah, no, absolutely. And I think because we have audience from all over the world, we know that mask availability globally has been a problem, but in general, if we're in the general population, we should be covering our faces. At least for me, it helps me not touch my face.
Absolutely.
Yeah, and the next question that we actually we're going to address is sort of staying active, right? We wear masks when we go out, but then like, what do we do when we're stuck at home all the time? How do you stay active, Ashrafi, during these times when we're on quarantine?
Yeah, Karika, that was really, a tough one, especially since, gyms are closed, clubs are closed, and, all of us tend to do some kind of activity. And so, there's one thing which I really discovered was my love for running outdoors. And this just happened over the last 2-3 weeks when Singapore was put on the circuit breaker. It just yeah, and so I think the important thing is is that we must sort of set aside a certain time period during the day to sort of exercise, and and sort of stick to it. Set some activity goals. We're lucky in this technical world to have Fitbit apps on the phone. I personally like the Nike app. It's really good, and we're going to send you links of various resources that we thought would help you keep active indoors as well as outdoors. And so that's really important. And then I found that even getting an accountability partner. I mean, my husband and I, at the end of the day, we always like sort of checking who's got more steps and who's got more activity, and that keeps us going. I think accountability partner is a great thing. So yeah, keep active. And definitely staying active is and exercising is such a mood booster, and a stress buster. I'm sure we all have ups and downs and during this time, and stressful moments. So it helps. It really helps. So stay active.
Yeah, and the competition helps for sure. With very like there's no sports anymore. That like everything stops. So you got to have something going, right?
Yeah.
Rafi, so the other question that we wanted to address is shopping, right? Like we see in the news all the time, people are going crazy in supermarkets and they're hoarding things, and we don't know how much of those things are actually necessary and if they're sourcing the right thing. So how does one navigate in terms of making good choices while shopping, and also just making good choices in terms of what to keep at home and stock up? Can I have the next slide?
So, yes, please. The next slide, please. Right. So, there are two things that I would like to sort of address over here. One is, of course, making better food choices. And, we all of us didn't have a certain way of eating, certain preferences, certain kind of diet, lifestyle that you're following. And, it's all sort of, gone a little bit awry because of the restrictions put on the, what food is available and the restrictions on supermarket shopping. But I must sort of emphasize on the fact that we must continue to eat whole and nutrient-dense foods, and avoid the packaged processed food, especially the junk foods like cookies, chips, instant noodles. So and following that, the nutrient-dense foods will definitely help boost our immunity. So and examples of these are things which are available, and you can sort of stack it up. And these foods are nuts, beans, seeds, cheese, meats, and eggs, all and green vegetables. All the vegetables that grow above the ground are all high and so nutrient dense. Yeah. So it does make sense. And follow the 80-20 rule. I've seen all my friends posting on Facebook. Everybody's using their extra time and creativity in sort of whipping up baked goods with their children, which is all good. But then this does have a lot of sugar and refined flour. So that's one. And and the other thing is shopping. We're going to send you a link in the resources later on, which tips on how to sort of shop and stack up but not hoard. It's a very interesting link, and you can go through it. So yes, that would be something which you can follow, and use more interesting things like meal plan your meals, and go online, see if the particular store that you're going to, whether it has the items that you have in your list. If not, then think of alternates, so that you don't spend too much time in the supermarket and you have everything that you want.
Yeah, no, absolutely. I think planning is something that's so important. Like we think about the fact that, oh, we're home, so we've got more time. But the reality is we actually need more discipline when we are home, and planning those meals out is definitely a big factor. Just a little bit of housekeeping for anybody who's struggling with the view for the PowerPoint. go to the top of the Zoom screen and click on view options and click on fit to screen. This is if anybody is struggling to get the whole presentation. I'm sorry, Ashrafi, you know, going back to what are some easy cooking tips that you often like to give out, like to your patients or to your friends who are baking, who are doing, you know, who are doing some of these things and are exploring cooking, like for someone cooking 101.
Yeah, no, absolutely. I mean, stews, like I just discussed, one pot meals, crock pot, use your crock pot, and I just discovered a recipe I've never made before and tried before. It's Moroccan stew, very whole, nutrient dense ingredients. Family loved it. And, easy, and you can sort of make larger portions and have it the next day. And talking about portions, quite a few of us are new to cooking, and we've been we made to cook more at home. So do bear in mind the safety of the prepared food and how many days you can consume it.
Oh, yeah.
Yeah. Like this morning, we one of the doctors did bring up something about, something. Yes. And so to address that, we are sharing a link in our resources later, which will tell you about how to ensure food safety later on.
Foods definitely last on the shelf longer than others, for sure.
Yeah, absolutely. And the other thing I do is start experimenting with a lot of herbs and spices, and these are things which have a longer shelf life. You don't have to worry about that. You can sort of stack them up, and they make for a pretty interesting and tasty meal. And like I tried this recipe about Jamaican herbs and chicken with Jamaican herbs, and it turned out really good. Never tried it before. So experimenting with those might be a better idea, and sort of it'll sort of add an extra element of oomph in your cooking versus vis-a-vis all the baking that we are doing.
Yeah. And you guys, Ashrafi is actually going to share some of her favorite recipes in the resources that we're going to share with you. So hopefully for those of us who are not as, as good at cooking, we'll get those recipes. The next question that we get that we actually don't talk often about is sleep, right? When your schedule is thrown off in terms of work and meetings and things like that, we think that we get more sleep. But some of us get less sleep during a period like this. What's your opinion on sleep? How important is it? And how does it all fit in this whole scenario?
Yeah, true, because you don't have to set your morning alarms as to sort of get to work or send kids to the school. So I do sort of I must admit I do sort of tend to extend my Netflix time. But having said that, I do try to get in 7 to 8 hours of good sleep. I think sleep is really important, and I think it's a great time to catch up on sleep. We don't have to travel overseas. We don't have to travel to work. Sleep, the quality and the quality of sleep is very important. It improves your resilience, lowers your adrenal and stress hormones, thus improving your immunity. So immunity is really important. And so I'm, definitely make the most of this moment and time and get your sleep-ins and get the extra wings. And definitely. It's so helpful.
Absolutely. I often when I talk to patients, they're like, okay, what else besides food and exercise can I do to lose weight or to be better? And we're just like, sleep. And they're like, really? Sleep? Yeah, sleep, right? And like lots of new studies are linking sleep, lack of sleep, to a lot of comorbidities.
Absolutely.
And so, we keep hearing it in the news. If you have more comorbidities, you're having poorer outcomes with COVID-19. So it's one of those little things that I think a lot of us can pay more attention to. Talk about sleep. I want to kind of segue this into something that's related to sleep that helps us stay awake. Coffee. And a particular type of coffee has been in the media a lot recently, the Dalgona coffee. And I think Bonnie actually has an interesting, idea that Bonnie and Ashrafi, they were talking about this recipe because they're clearly the cooks in this session. Bonnie, please talk to us a little bit about coffee, the Dalgona coffee.
Yeah, so you can definitely still have Dalgona coffee and be healthy. The main thing is just switching that sugar with erythritol, which is a sugar alcohol, and it can still whip up that foam, which you see in the photo. And we'll send you the recipe later as well. So yeah, still fine to take, but just remember with coffee, caffeine, these do keep you awake at night. So try to finish drinking those like before 3 p.m. so that again, you get that sleep, which is really important for your immunity, especially in these times. That's probably one of the biggest things you can do to help yourself. Other than that, of course, there's alcohol. Next slide.
Next slide.
It has actually been shown when you take excess amounts to suppress your immunity. So the recommended maximum intake would be 1 standard drink for women and 2 for men. So if you don't exceed that, it probably won't reduce your immunity that much, but any more than that, it actually does. And the mechanism is that there's 2. So when you drink alcohol, it actually alters your gut microbiome, which, as we all know, the immune system actually is predominantly located in the gut. And secondly, the intestinal wall actually is slightly damaged when you drink alcohol, and that actually lets more pathogens into your body. So that's why it's really important that you try to moderate your alcohol intake during these times. I think it's quite easy to do that when there are bars and, you know, the social aspect is kind of like not here anymore. So that's a great way for you to go dry during these times. And secondly, alcohol does disrupt sleep as well. I know a lot of patients will say that that glass of wine helps them sleep better, but that's only in the initial stage. So there has been research that showed that during the sleep itself, it actually can disrupt you. And I've experienced that myself when I binge drink. I just kind of fall in and out of sleep, even though you kind of feel like you're sleeping, but you're not actually.
They're like, oh my God, when I have this glass of red wine, I fall asleep so much better. But you're like, yeah, but the quality of sleep, since we have so much digital devices now, when people track it, a lot of them actually have poor quality of sleep when they drink. So thank you, Bonnie, for that. That is something that's important for immunity and for sleep. So what else, in terms of metabolic health and anti-inflammatory food? Sorry, just for some housekeeping, this is the first time we're doing this. So if anything is off, please, accept our apologies. I think one of you actually asked a question about Dalgona coffee, what it is. We'll try and address that towards the end as well. But so in terms of metabolic health and anti-inflammatory foods, what are your favorite foods that actually helps with metabolic health and reducing inflammation?
I can answer the Dalgona coffee first so that they're not like thinking about it the whole way. It's this kind of trending thing, like it basically was from this Korean candy where they kind of whip up sugar and water together and it creates this foam. And so like that's what it looks like as a candy. And then so everybody started like whipping up sugar and coffee together to make a foam, and you put it on top of milk. And so it looks really pretty and it tastes nice because it's full of sugar. But basically that sugar is not so good for you. So I think because everyone's cooked up at home, they're just trying out all these recipes and we're just giving you ideas on how to make
Everybody's trying it out. And then like Ashrafi, Bani, and I are like, it's nice that people are doing these things, but we're like, what are they doing with it after they make it? They're probably drinking it, which is a lot of sugar. And hence we decided to address something that's like a common trend. Sorry for anybody who didn't catch that because we went through it fast. Yes, go ahead. Sorry.
On to metabolic health. Basically, we're looking to reduce inflammation in the body. And one of the main ways we can do that is by eating like high antioxidant foods. So those are things that are colorful and plant-based. So for example, berries. Just bear in mind that frozen is absolutely okay, because especially in these times when stocks may be running low, you can definitely go for frozen veg, frozen berries. They actually retain the nutrients better than fresh, and they're cheaper as well. And things like turmeric, dark chocolate, try to go for those that are above 70% cocoa, because anything below that, they can be a bit high in sugar. green tea, ginger, and dark leafy greens. Extra virgin olive oil is my favorite oil. It's really high in the polyphenols. As we all know, the Mediterranean diet can help protect your heart as well. So these things can all benefit your metabolism. And salmon, of course, yeah, high in omega-3 fatty acids. And another interesting thing is that when you take in a lot of processed food, especially things that are high in sugar, there was this study that showed that taking about 100 grams of sugar, which is equivalent to about 2.5 cans of soda, it actually reduced the white blood cells germ killing ability by 40%. So if you want to take care of yourself, try not to take too much sugar during these times. And another
like
thing is
white blood cells that help us fight infections, they actually go down because of sugar.
Yeah.
Oh, wow. That's an interesting study. Thank you.
Another thing that can reduce inflammation is also short-term fasting, like intermittent fasting. So probably something like the 16-8 diet. If you haven't tried it, it's a good way for you to try it out to reduce your inflammation. Probably nothing like super extreme like fasting for a few days because you still want to stay well nourished. But some short-term fasting actually can help. Okay, next slide.
Yeah, just to add that, 16-8 is basically time restricted eating where you sort of eat only within 8 hours and you sort of fast for 16 hours. And during the fasting period, you're of course allowed to have water, drink water, green tea, that's fine. And I personally think this is a great time to start it because, we're at home and we can sort of make some new habits. So yeah.
Absolutely. And also with Ramadan coming up, I think this is a good chance for us to also join in with our Muslim friends who will then be fasting in the middle of all of this as well. So I think it's a great time to be thinking, reading, talking about these things as well. So next slide, please.
Yeah, and it can definitely be easily done just by, for example, cutting out your supper and not having that nighttime snack. It's actually, you can probably easily achieve that fast. Okay, so a lot of questions around supplements and nutrients that help with immunity. And I just need to caveat this with saying that all of these research studies are actually not on COVID-19 because it's so new, like we can't possibly get research on that. It is mostly based on the cold and the flu. Not to say that, these supplements don't work, but it's important that you just focus on the really important things, which is like social distancing, hand washing, good hygiene as your main focus. And these like as a bonus. So don't have like a false sense of security that you can go out to parties just because you're taking some garlic supplements and stuff. Yeah.
I want to go to that party.
Zoom party.
Yeah. We have Zoom parties, not real parties.
Okay. Next slide, please.
Thanks. So zinc is one of the really important nutrients, and it can improve our immunity in many different ways. By taking a zinc supplement, it was shown to reduce the cold duration by about 1 day, and it reduced the number of respiratory tract infections in children as well. But the effect is not very big. And some of the most effective studies showed that you needed to take about like 18 milligrams a day, which is like the amount, like double the amount where people start to get like gastric symptoms like nausea or diarrhea. So I would definitely suggest you try and go for food where possible. Only if you're really, struggling, like maybe you're vegetarian or so, especially the elderly, you could consider like supplementing at a normal level that just meets your requirements. And some good sources of that include like oysters, fish, meat, and beans, seeds. And when you soak the beans, it especially is good to reduce the phytate level, which improves zinc absorption as well. So I've actually been doing a little bit of sprouting myself.
Oh, nice.
You have to be really careful with those. Have to wash it like every day. But sprouting is a fun way to while away your time at home.
Yeah. and keep the kids involved.
Yeah. Oh, get the kids involved. You're right.
Yeah.
So that's a very good point, because I don't know how many of our viewers are more plant-based. So, you know, they may just look at it and say, oh, seeds and legumes give us zinc, but yeah, definitely soaking helps with making it more absorbable and so more bioavailable for us. Thank you. Next slide, please.
Okay, so vitamin C, I think, is one of the most popular ones. And there is a good amount of research that shows that it can reduce the duration of colds, but it's not very significant. It's probably about 1 day. It also didn't really reduce the chance of catching the cold virus. But basically, how it works is that it can boost the antibodies and the white blood cell count. And about 12% of Singaporeans are not really eating enough. So the best way to source it is from food. So things like citrus, broccoli, spinach, kiwi fruit, all these are really great sources of vitamin C. So you shouldn't be drinking orange juice, because that would be the thing that's causing you to lower your white blood cell count. But eating that whole orange, or even going for a cup of broccoli, actually surprisingly contains more vitamin C than one orange. And capsicum as well is really high. So especially the yellow capsicum, which is like in between, red and green, is actually the highest in vitamin C. And chili also is really high in vitamin C as well. And like a fun fact is that the green chili actually is the highest rather than the red. So yeah,
spice your life, right?
Food.
Yes, something to spice up our life. Yeah. And you know what? I have a tip here, and that is, I sometimes when I do buy some little extra broccoli, I do sort of freeze it in so that I can use it, so that it doesn't get spoiled, and I don't have to go to the supermarket. So I do ensure that the family gets a bit of vitamin C in some form or the other through the course of the week.
When we're low on produce, and like for our participants who are living in like countries where it's still cold, freezing stuff can just help you not go to the supermarket as often and have produce throughout the year. The other point is, like, we always think vitamin C and orange, and the three of us actually were trained in very different backgrounds, but all three of us agree that nobody should be juicing their fruit as long as they have teeth to chew. Right. And it it just became a thing, orange juice for vitamin C. And so now after this, you guys are going to say broccoli for vitamin C. Hopefully you'll take that message.
And chili.
All right.
So if you do really want to supplement with vitamin C, I would advise you just be cautious about it, because if you have, say, like iron overload or kidney stones issues, or you're taking iron supplements, it could be not so ideal to be supplementing with like really mega doses, which you usually find in the pharmacies. So just keep to the RDI, which is like 105 milligrams for men and 85 milligrams for women. Okay, so moving on to the next mineral is selenium, which can actually reduce inflammation in the body. Most people probably have sufficient amounts. Again, it's mostly the elderly who are more at risk. And there has been some mixed results with supplements. So there was a study with people taking flu vaccine, and they were given selenium supplements, and then later tracked to see whether that helped reduce their chance of catching the flu. And it didn't really show such positive signs, even though we do know that like selenium intake in food can actually help. So that's why I say it's always still best to go for food where possible. And a really good source of it would be Brazil nuts. You only need 2 Brazil nuts to meet your entire day's selenium requirements. You can also get it from yogurt and meats and whole grains as well. Okay, next slide. Okay, so vitamin D is another big one. And it's really surprising that in such a sunny place as Singapore, there's actually 30% of people who are actually deficient in it. And mostly it's because I think people are just working indoors and not going out that much. And I think especially in these times when we're all cooped up at home, it's really easy to become deficient in vitamin D. And so I would say, especially because 90% of the vitamin D in your body actually comes from the sun, not from food. So it would be good if you could perhaps move your work desk near the window, or you could maybe go out to the balcony and get some sunshine at your lunch hours. And only if you really can't, go outside and get sunlight, then do consider like taking a vitamin D supplement containing at least 400 IU. Okay, next slide. You can also get it from food like butter and milk, but it's very insignificant that you get from food. So the other big thing is gut health. And as I said before, about 70 to 80% of your immune cells are actually located in the gut wall. And so it's definitely a huge factor in your immune system. And we do know that the bacteria that lives in our gut helps regulate the immune system a lot, and it helps nourish our colon cells to make sure that pathogens can't enter our body. So it's quite good to know that some research shows that some strains of probiotics, including lactobacillus and bifidobacterium, actually helped reduce the cold duration by almost 1 day. And I think if you're taking yogurt or kefir, like that also contains like vitamin D and selenium and zinc, that also helps improve your immune system as well. Okay, next slide. And the next thing that's big is herbal supplements. So I've just summarized 3 of the main ones that have a bit more research behind it. Garlic has been shown to have antimicrobial, antiviral properties. And there was a randomized control trial showing that some garlic supplements did reduce a cold duration by 70%. And it also did reduce the chances of catching the cold, but it was a very small study with only 146 people. So I wouldn't advise you should definitely run out and get it. The other one is echinacea. So a Cochrane review, summarizing several different studies, showed that it did reduce the risk of getting a cold by 10%, but that's really tiny. It's like 1 out of 10 people might not get it, but it is really expensive, so I wouldn't hedge my bets on taking that. Olive leaf extract also, again, it was a fairly small study. There were about 32 high school athletes, and they took about 100 milligrams of the oleopurin, which is an antioxidant in this olive leaf. And that actually did reduce the cold duration by 28%, which is about 1 day or 1.5. So again, it's not really gonna give you a huge bang for your buck in terms of your nutrition. If you really want to take a supplement, because somebody asked, was there a one in everything included supplement that they can take during these times? I probably would suggest, if you really want a multivitamin that covers selenium, zinc, vitamin C, vitamin D, but otherwise the other ones, there's too little research to be making recommendations, and definitely try and get it from food where possible.
Yeah, absolutely.
Agreed, Bonnie. We just had a couple of supplement related questions for the group from the chat while we're still on this topic. Somebody asked if there's any remedy for low iron while living at home, during these COVID times. So I wanted to give, either one of you the chance to answer, and hopefully I can chime in as well.
So iron mostly comes from animal foods. That's the most highly absorbable form of iron. So I don't think it's particularly because of being quarantined at home that you're at higher risk, unless you're not eating meat, like you're becoming vegetarian for some reason, in which case you should try and focus on more of the vegetarian sources of iron, which would be nuts, seeds, beans, and then taking vitamin C together with your iron-rich
Combination.
food, like capsicum and all that.
Absolutely. And iron is also very interesting because depending on your age, your gender, your requirements really change. I mean, there's going to be a difference between like if you're a menstruating young female versus if you're a postmenopausal female versus if you're a male. And yeah, so in terms of vegetarian sources of iron, they are not as bioavailable compared to animal sources. So yes, combining them with vitamin C rich foods will really help. So, you know, that would be like preparing your beans with a squeeze of lemon or with a little bit more chili, right? So if your beans are going to be your source of iron, then your lemon and your chili is going to be like your Moroccan soup, Ashrafi,
Yeah.
is going to be a good source like for a vegetarian to get that absorption. And for people who do eat animal foods, red meat tend to be a very good bioavailable source of iron. Fish, chicken, eggs, and things like that.
And
So
also like chicken liver.
yeah,
Yeah,
absolutely.
organ meats are really high if you are not vegetarian.
Yeah, yeah.
And if you're like binging on tea for some reason in quarantine, then just be careful to try and separate your tea intake with your iron foods, because tea does inhibit the absorption of iron.
Yeah,
Yeah,
absolutely.
definitely. Timing it away from the meals is a very good intervention in terms of enhancing absorption. Great. Can we also answer one quick question? Does alcohol increase risk of cancer? Was one of our live chat questions. And I think, you know, this, since my background is in oncology, let me start. You know, I think the main thing with alcohol is that there are some studies that say any amount of alcohol increases risk of like lifetime risk of cancer, specifically breast cancer and things like that. But most studies seem to indicate like the amounts that Bonnie indicated, that men can tolerate up to 2 units of alcohol per day, and women 1 unit. You know, but if you think about alcohol's effect on metabolic health, you know, it does cause fatty liver when consumed in excess amounts. If it disrupts sleep, it can also cause a lot of metabolic derangements, and metabolic illnesses are associated with cancer. So even if it's not a direct correlation, except for some cancers like liver cancers and things like that, you know, and esophageal and all those, it is indirectly linked to a lot of the cancers and overall chronic illnesses. You know, Ashrafi, Bani, if there's anything else to add on that.
I think especially if you have the Asian flush syndrome, which is very prevalent among like the Asians, and where you get like a red flushing and you might get palpitations and stuff. You're at really high risk of cancer if you continue to drink. But usually, because of these symptoms, people don't like to drink if they have that condition. But just to be aware, if you have it and you still want to keep drinking, it actually you're at an even higher risk than just the general population, because you're getting more the toxic effects of alcohol than a normal person.
Good point. That's a good point. All right. So yeah, go ahead with your next slide.
Okay. Yep. So the other interesting thing is that I found was that soup actually does have some pro-immune effects. So it's not just like an old wives' tale, and there's some merit in, you know, having, especially the bone-based broth. I think the research found that when it was combined with some vegetables as well, like in the soup, it contained this amino acid called carnosine, which helped to reduce the inflammatory response in cold symptoms. So I think definitely go for having some soup in your cooking. And one of my favorite soups would be tom yum soup, because it contains like all the pro-immune herbs and spices. So like garlic, for example, has allicin, ginger or galangal, and chili, lime has vitamin C, chicken bone and prawns, they have the vitamin D and iron inside. And if you added some mushroom as well, especially shiitake mushroom, has been found to be very good for your immune system. So definitely try out the recipe that I'm going to include in the resource handout that we're sending out later.
Yeah. And Ashrafi, I know you make bone broth quite often. I know it's one of your favorite things. So your opinions on bone broth, how to source it, and also another question on how do you grow food in Singapore? One of our participants.
Yes, I know. I saw that question as well. Right. Yeah. So bone broth is like a family favorite, and we sort of make the broth, using various bones. Sometimes it's chicken, sometimes it's lamb, pork, beef, and I make it every week, and then we store it in the refrigerator. And mind you can't have it more than a week in the refrigerator, but you can freeze it. Yeah. So I think it's very therapeutic, and like it's like chicken soup for the soul. So that's a famous food, yeah. And it also helps in with the gut and the gut lining, and and all that Bonnie mentioned. So yes, please. And there are, and if you can't make it at home, it's becoming difficult to make bone broth at home because there's so many demands on the kitchen these days. Right. Yeah. And so you can source it. You get bone broth outside, and in sachet form, or just bone broth package. So you could sort of do that as well. Yeah.
Great. Thank you. Thanks for that.
And answering the question about grow your own food, being co-owner of the company, the urban farming company, you can sort of see it's called Edible Garden City, and we do have online workshops on how you can grow your own food, and even in a small balcony, and like herbs, and in fact we're doing very well with that because a lot of people have now got interested in growing their own food. So so it's Edible Garden City. Sort of look at it.
Thank you. You guys can check that out. So the next part that we wanted to cover, if we could get the next slide, is so we've given you a lot of information in the last 40 minutes or so, and now it's about application, right? Mindful snacking and mindful eating. At the end of the day, all of this knowledge becomes very difficult if we're not mentally able to practice a lot of it. So eating at a fixed time. Now, this is something that a lot of us struggle with because our days have been thrown off. So, the way we schedule consults or the way we schedule meetings, we should be scheduling times for our meals. I know that the three of us have not always been perfect in that, but I think that we're trying our best to start doing that more. So whether you're doing intermittent fasting and you're only eating 2 meals, at a given time, or you're someone that's eating 3 meals a day, make sure that you have those times so you have something to look forward to in a stressful day. And so it actually reduces cravings as well, because when is meal time, and that you're going to have food at that time. Can I get the next slide, please? Thank you. So the other thing is knowing your body's personal cues. Okay, so for me, whenever I feel hungry or I'm craving something, the first thing that I think about is am I going to be okay with eating some berries, or is this particular feeling going to be satisfied with some vegetables, right? And if the answer to that is no, and I want like a cookie, then it tells me that I'm actually craving food and I'm not actually hungry. A lot of my patients, they struggle. They're like, no, but it just I just need that little bit of bread. And often what ends up happening is it's craving. Sometimes you're dehydrated, or you've not had a satisfying lunch or the meal before that. And so you end up craving something in between. So that's why it's important to, when you do eat, that you have a satisfying meal and you're able to identify when you're truly hungry versus when you're actually a little bit, just craving something. Can I get the next slide, please? All right, so create a conducive eating environment. So this is something that like we're guilty of, because we're using a lot of Zoom meetings right now, that sometimes we're drinking coffee, we're getting a bite to eat because of our busy days. Now, making sure that our environment is conducive for eating. So you're savoring the food, you're chewing the food, you're smelling the food, you're watching your child eat her meal, his or her meal, you're watching your spouse. Actually, all of that plays into it, because at the end of the day, desk environment is work environment, and dining table or environment is for food. And all of these things psychologically make a difference. If you're going to be eating, working, sleeping all in the same place, your body's not going to be able to self-regulate. So that's something that's really useful, that, you know, when you do eat, you know, to put away devices. I know it sounds very touchy-feely, but it does work. It takes some time, you know, but that habit, you'll build it over time. All right, can I get the next slide, please? So you know, the other thing is out of sight, out of mind. I always tell my mom this, or I tell some of my patients this, because they're like, you know, sometimes I buy Ben and Jerry's for my 10-year-old daughter and it's just in the fridge and I'm tempted to eat it, right? And so out of sight, out of mind really does apply, because at the end of the day, we can still go out for a walk. We can still go out to get food. And of course, we want to limit that, but we also want to limit eating junk food. So if you really do want that dessert, try and not make it available at home. You know, make sure your kitchen pantry is full of things that you have made a point to eat, and not things that you're going to regret about eating. So it actually gives you an incentive to go out, walk out, and enjoy that little piece of dessert. And like Ashrafi said, the 80-20 rule, right? 80% of the time, you eat the foods that are in your pantry, and 20% of the time, you give yourself permission to enjoy the things that your kids can enjoy, and enjoy some of the sweet cravings that you may have. All right, can I get the next slide, please? Can I get the next slide? Thank you. And again, we apologize for any technical difficulties. So you've tried all of this. You've timed your meals, you've cleaned up your pantry, you've moved to a different desk, and you're still craving it. All right, so what do you eat? So, you know, some good snack ideas are some, you know, hard-boiled eggs. They last a long time in the fridge. You can make a large batch and you can store it, and they're easy to kind of spice up and throw in a little bit of flavoring. It's a good snack. And then, you know, maybe some vegetables with some dip. You could have some cheese as well, because these are all combination of protein, fiber, and some healthy fat, right? And all of these things take very long to digest. So you'll actually feel more satisfied for a longer period of time. When things take longer to digest, they also keep you full longer. So the other thing is yogurt. So again, yogurt's a good combination. You can throw in some frozen berries, or you could throw in some shaved coconut or some nuts and things like that. These are all, again, giving you that combination of nutrients that are all going to be harder to chew, harder to digest, and so they stay in your stomach longer and they give you more satisfaction. Nuts. So nuts is a tricky one. It's a great source of protein, fat, and fiber, but sometimes some of us get carried away in terms of portion control, especially if they're roasted, salted. So always pre-portion the nuts, and, you know, make sure that you put it in a tiny bowl and move away from the large container of nuts before you start indulging in them. So they're just some, you know, tips to psychologically just manipulate some of your surrounding and what you make available to yourself to cope through some of these times. Yeah, to essentially summarize this portion of it, we just want to encourage people to be able to make nutrition decisions in the right direction 80% of the time, and 20% of the time, it's okay. It's okay if you had to,
yeah. And I think this is also a time to sort of consolidate. Yes, it is a difficult time with everybody at home, challenging times. We don't know what the future is going to be like, work, businesses, kids' future, etc., which we are all might be facing. But I think the important thing is to consolidate, to sort of take time out for good sleep, good nutrition, exercise, as well as self-care. Take some time out to look after, take some time out of the day to maybe have a relaxing bath, to listen to some music, to do some Zumba, whatever works for you. And, so that when this whole thing ends, we are sort of healthy and fit. And just before, there was a question on pescatarian broth, and yes, that's possible as well. You can sort of use the whole fish along with the bones and sort of make a broth with that. It's a question from somebody who's a pescatarian and doesn't eat red meat or chicken. Yes, that's absolutely possible as well.
Absolutely. Thank you for answering that. So the next question, this is one of our submitted questions, and the person basically asked what kind of foods, to the previous slide, please. What are some of the foods that actually help in terms of boosting your mood? right? So I know Ashrafi has her favorite dark chocolate in there. So I'm gonna start with the dark chocolate.
Absolutely.
So dark chocolate contains some compounds like caffeine mainly. It also contains theobromine, and some of these compounds apparently have, some studies have shown, has the same effect as cannabinoids and hence can actually boost your mood. So you know, husbands who are listening to this, you know, women crave chocolate for a reason. So it's a great snack as long as, like the way Bonnie said, you know, as long as it's dark chocolate and doesn't have a lot of sugar added in it, so you get more of the benefits from the cocoa compounds as opposed to the sugar. And then, you know, the other one is caffeine, which, you know, also we addressed briefly before. So caffeine has shown to actually boost mood. So it makes us think that in the mornings when we're cranky because we don't have the coffee, is it because of is it because we don't have this mood boosting effect of the coffee? So that's another great mood boosting food item that we can include. The third one is actually berries. Now with berries, it's not clear what the mechanism of action is in terms of helping with mood changes, but they do attribute it to the anthocyanins that berries are rich in, which are again a type of antioxidant. So again, it's a high fiber, high antioxidant, low sugar food. So if you're able to source them and freeze them, great addition to your freezer for sure. And then a bit on what Bonnie touched on in terms of fermented foods. Now, 90% of your body's serotonin is actually produced in your gut. Now, serotonin is a neurotransmitter that actually controls a lot of human behavior. It controls mood, it controls your sex drive, it controls stress, appetite, all of these things. So when you're eating fermented foods, it actually is really good for your gut, and it's shown to increase serotonin levels. So it in turn improves mood. So some fermented foods, like she mentioned, kimchi, kefir, yogurt, buttermilk, kombucha, thank you. So most of these fermented foods, in many cultures, you know, there are fermented foods that are available in many cultures, and they can all be really good additions for boosting the mood. Thank you. Next question, please. Next slide. Yeah, thank you. So the next question was, can an alkaline diet reduce inflammation? So before I answer that question, I would like to talk a little bit about what that means in terms of alkaline diet. So the idea behind the diet is that certain foods are alkaline and certain foods are acidic, is the theory. And if something's acidic, then the pH is going to be less than 7, and if something's basic or alkaline, it's going to be more than 7. Now, that implies that we can actually control our blood pH, which actually remains relatively stable anywhere between 7.35 to 7.45, like, because our kidneys control the pH of our blood. So it's not possible to use foods to manipulate blood pH. However, you know, if you think about our stomach is actually highly acidic. And you know, because it digests food. And if you think about our saliva and urine, those things can change pH as well, depending on what we eat. And as part of the alkaline diet, they say eat lots of vegetables and fruits and nuts and beans. And we agree with a lot of those foods. What we are worried about is that it says no dairy, no meat, no eggs, and no caffeine and no alcohol and all of those things. So some of it is a little bit harder to digest. So it's got a lot of good elements of it in terms of what it's promoting. I think we mostly disagree with the theory behind it. Do you guys agree?
Yes, absolutely. Because you know the greens and the vegetables and the fruits definitely you know just you know promote overall good health. So you know it definitely helps in a general sense of term. Yeah. So I agree with what you're saying, Karthik. Okay. Absolutely.
All right. Can we get the next question, please?
Right. So I think
Yeah.
this question was, I have high cholesterol and what to eat, and what we understand from this is that you're referring to high LDL. So I would like to answer in two ways, by splitting it into two and saying that, okay, what you can eat and what you can't eat. So what you want to avoid if you have high cholesterol is that you sort of want to avoid the processed foods because they are high in sugars, hidden sugars, carbohydrates, and trans fats. And trans fats and carbohydrates and sugars are, cause high cholesterol. And what you really want to eat and so sort of, bring your cholesterol down is again whole foods, which include lean meats and, vegetables that grow above the ground, which are, which are nutrient dense and soluble fiber, and, nuts and beans and seeds. So all these, and eggs, so all these are foods which will sort of help in bringing your cholesterol down. So what do you think, Bonnie? Do you have anything to add to this?
No, yeah, definitely agree with all the high fiber foods can help basically inhibit the absorption of cholesterol in your gut. So that's the mechanism. The other thing is if you have a lot of fatty meats in your diet and so on, you can replace some of that with some of the unsaturated fats, like extra virgin olive oil or avocado oil, nuts. Those can also help reduce your LDL cholesterol. And if you're referring to triglycerides, then it would mostly be reducing sugar intake and alcohol that would help reduce the triglycerides.
Absolutely. Yeah, cholesterol is kind of a tricky one because I think what it ends up happening is it's a lipid panel and you have HDL, LDL, total cholesterol, triglycerides. We could do an entire webinar on cholesterol. So, to be determined, maybe in the future we could talk more about it. Could we get the next question, please? All right. So we actually had a patient that has a type of autoimmune condition, lupus or rheumatoid arthritis, and the person actually asked if that actually reduces her immune system. So we actually had a discussion about it within the team, and what ends up happening with people with autoimmune conditions is it might not be the disease itself, but some of the medications that they take that could sometimes reduce their immune response to certain things. So it's definitely a conversation you could have with your doctor, but the basic things still apply in terms of hand washing and wearing masks and social distancing. All of these things apply to you as well, but have a conversation with your doctor about some of the medications and what the effects of them are going to be. Next question, please.
Right. So there were a couple of questions on feeding a young athlete, and yeah. So Kartika said, I should answer this because I have a young athlete at home. Yes, it's really tough to keep these young athletes at home, not able to do their activities like they used to. And so there are two things to this. One is, athletes, because of their, the amount of training that they do, the intensity of the training, the frequency of the training, and the endurance. And, so obviously some of them sort of have, load up on carbohydrates. And what I would like to sort of address here is that you can, since the intensity and the frequency and has gone down, you can sort of reduce the carbohydrates, especially if your young athlete has been is having sports drinks like Gatorade or 100 plus, which is full of sugar. Yeah. You could replace those carbohydrates with whole carbohydrates and slow carbohydrates like, say a sweet potato and brown rice and beans and, green vegetables and some fruit and berries. Yeah, so that is one. And then
their food.
Absolutely.
Right?
Yeah. And and many athletes do sort of tend to sort of have some protein shakes. Whey protein shakes is very common, and if you're not training that much, then maybe you could sort of look at more whole foods again, like meats and eggs and dairy and cheese and some beans and nuts and seeds are the where you can get your protein sources. So that's what I would sort of suggest.
Yeah, no, definitely. And I think from experience, you are managing a young athlete right now. So that's some real life advice, you guys. All right. Bonnie, do you have anything to add to that?
No, I don't have experience.
Me neither. Me neither.
No, but yeah, a lot of patients will use, running a marathon or even just exercising to like do carb loading. And
Mhm. Yeah.
like, no, I mean, like if you're not really running a marathon and if you're not a professional athlete, I don't
Yeah.
think you should be doing carb loading.
Yeah. Absolutely. In general, like I tell my patients, like unless you're someone that's exercising more than an hour and a half, 2 hours, high intensity, a lot of times you need more hydration and electrolytes than any of the sugary drinks like the Gatorade and Powerade. So I think that applies across the board. Thank you for that. Can we get the next question, please? All right. So we had a question about DHA, EPA, and immunity, whether it, how much one should take, if one should take in order to improve immunity. So take it away.
So yeah, this participant asked specifically EPA, which I'm not sure why, because the research has been mostly on combined marine omega-3, so that includes DHA and EPA. And the research out there on immunity per se is, it does show there is positive effect on it, but there's no specific guideline on what dosage there is. But if we go by like general guidelines for healthy, heart, we do recommend about 500 milligrams a day on average. And that usually translates to around 2 to 3 servings of fatty fish every week, one serving being like 100 grams, or about 1 pound size. Fatty fish being things like salmon, tuna, herring, mackerel, eel. So those are especially high in omega-3, and that has been, shown to be beneficial for improving our mood and reducing our risk of heart disease as well.
Yeah.
I would definitely suggest to go for eating the fish rather than the fish oil supplements where you can, because there has been research to show that it's mostly the fish that actually had beneficial effects, and probably because it has combined nutrients like vitamin D, the healthy protein inside, and
And the
selenium,
good
like
fats.
all those other nutrients that are beneficial for you. Whereas in the fish oil supplements, it's just the fat itself, and it's not as fresh as well. So unless you can't take fish, then yeah, go for the food where possible.
Absolutely.
And I think because Kartika's vegetarian, she also has some tips on like what vegetarian supplements there are for getting your DHA, EPA. Well, it wouldn't be DHA, EPA, it would be another ALA instead.
Yeah. No, definitely. Yeah. So Ashrafi was going to talk a little bit about the ALA. What I did want to add was, the fact that we always think about fish oil in terms of supplement. And I always wonder in terms of all that extra processing, if you're able to eat the food itself, it is always a little bit easier and better, at least, in terms of like one less pill to swallow. Yeah, Ashrafi, you can talk about the ALA, which was not mentioned in this question, but is relevant for vegetarians.
Yes, so the ALA, the body is not able, I mean, you get it from things like chia seeds and flax seeds and walnut, but you're not able to convert it into EPA. And so in that case, we do definitely, recommend having a supplement, as Bonnie mentioned, and the doses that she mentioned. So yeah, absolutely.
I think there was a question on fish oil and ADHD. So I think there is a little bit of research
on that, definitely.
show that it could potentially help improve symptoms among children between 8 to 12. So yeah, you could go and see if it works.
Yeah, and it's also generally used in combination with some of the ADHD medications. So research seems to show that they work synergistically, the EPA DHA along with the ADHD medication. So yeah, so it's not necessarily a replacement, but it can definitely help management, for sure. Can we get the next question?
Okay, and I think there was someone else who asked about general immunity and the effects of aging and weight gain. So for aging, definitely as you get older, your immune response usually is not as optimal. And as we know from like the COVID situation, that's definitely the case. And that's probably from several different factors. Like as we get older, we get less muscle, and that tends to, increase the amount of inflammation in the body. Generally, elderly also don't tend to go outside as much, so they probably don't have optimal vitamin D levels. And also they can't really metabolize nutrients as well. So like iron, vitamin B12, and so on. And generally there is like a reduction in white blood cells in the bone marrow. So all these things combine together to basically have a poor response to infections when you get older. But of course, there are ways that you can mitigate that, like just staying healthy, having a well-balanced diet to get all the nutrients that you need, and exercising to attenuate that muscle loss as you get older. And in terms of weight gain, I think especially for the COVID situation, there has been a bit of research that showed that people who are obese did tend to have more severe cases of the COVID-19 virus. And that's probably from several things, like including when you're overweight, you tend to have more inflammation in the body. And that means there's more of that cytokine response where you might actually overreact in terms of your immune response. And that's when your lungs can get scarring and things like that. And also the extra weight around your chest area also can reduce your lung volume, and that makes it harder to breathe as well. So if you are overweight, or if you're finding that you're gaining weight during these times, it's definitely a good motivator for you to try and keep that in check.
Definitely. Yeah, I've actually had a weight management patient who's been a long-term patient of mine, who's kind of gone on and off in terms of diet and exercise and things like that. And, I saw him again after a long time, maybe 5-6 weeks ago. And we talked about obesity and some of the comorbidities that are associated with poor outcomes with COVID-19. And that seemed to really be a motivation for him to change some of his behaviors. And I think that also brings us back to the point that Ashrafi was saying, that a lot of us have made a lot of progress, and then COVID-19 has kind of hindered that progress. And so you don't want this period to offset a lot of the good behaviors that you've engaged in. And so these are again some like preliminary evidence that it's really making a big difference, at least in terms of this pandemic. As well, and some motivation to stay on top of the routine, the meals, the exercise, the sleep, most importantly. Guys, I have another question that was submitted through the live chat. Interesting one. So they wanted to ask if sauna increases immunity, and also if it increases vitamin D levels. And you guys can take it away.
I'm sorry, I'm no expert on saunas. I don't know if it has UV rays, it might, but then does that increase the risk of skin cancer as well? So.
Yeah, Ashrafi, any idea in terms of sauna?
I think sauna just helps with passive sweating, which I have read about, but then how much it sort of helps in immunity, I'm not very sure about that. Yeah, so I haven't sort of read anything, or yeah.
Okay, I've read some studies that it does seem to improve immunity a little bit, but there's not significant amount of studies. And vitamin D, definitely, I haven't read enough about it increasing vitamin D levels. Get some sun, you guys. Whether it's from your window or your balcony, the sauna is great. In terms of relaxing, and there are some preliminary studies, but that would not be my go-to for my vitamin D. you know, in terms of this.
Now that, you know, like you want to kind of social distance, and in a sauna you're cooped up with, like, or if you're not cooped up, then at least you're at the reception area and you're interacting with people. So not sure if that's the best strategy right now.
Yeah, definitely. There was another question about when is the best time to take a probiotic. I've heard different instructions with different preparations, and I'm very confused. What's some of our suggestions for that?
Okay, so I did a bit of research on that because I sometimes take probiotics. There's actually not like a huge amount of evidence to say that it has to be taken at a particular time. Some studies did show that specifically lactobacillus and bifidobacterium tended to be retained better when you took it either 30 minutes before or during a meal, and that's mainly because of the fat that comes with the meal, and that tends to nourish the bacteria better. But I've also seen studies that showed that as long as you took the probiotics consistently, it actually had, you know, the same level of the microbiome in like after 1 month. So it doesn't matter a lot. I think consistency matters, and I would probably advise to take it like in a food source rather than probiotics if you can. Because that comes with the fat and everything, and you know, the extra enzymes and nutrients that come from the food, and the byproduct of fermentation is also helpful.
Yeah, I mean, it's time for you guys to look up culturally appropriated fermented foods. There are so many of them, you know, and maybe start fermenting foods like Bonnie does instead of baking, you know, on some of the occasions. Thank you for that answer, Bonnie. It's, you know, it's really been a wonderful hour, a little bit over hour and 15 minutes. Thank you all for all of your questions. You know, if there are any other leftover chat questions, we will include the answers in the resource list. Thank you so much for your time. And, you know, watch out for our resource list. We are from the Tucker Health team that's based in Novena Specialist Center. You can email us should you have any questions. All of that information is listed on this page. This is being recorded, and so if you have anybody that needs the recording, please reach out to us as well. Ashrafi and Bonnie, do you have any rapid thoughts?
Yeah, thank you very much. And yes, you know, it's important to look after yourself and, you know, look after your health and be safe. So thank you for joining us.
Yes.
Thanks for joining. It was nice meeting you all, even though you're all silent. But they're all really good questions. I think we didn't answer like every single one of them, but we can definitely email the remaining ones that are left.